What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It's time now for the Monday edition of the Pandemic Update for Monday, September 9th, 2024. Welcome to my channel if you're new to my channel. We start another week together here in a COVID pandemic, which is ongoing, and other viruses which are problematic as well. You have clicked on to today's pandemic update, where I will update you on the latest COVID numbers, some data on COVID, and some studies, and some other viruses as well. We also do have new Walgreens information today. I report on the work that the media has stopped reporting on. I bet you did not know, over the past several weeks, for multiple weeks in a row now, there have been 1,000 deaths weekly caused by COVID or in relation to COVID. Yes, just in the United States. And wait till you see today's number. It's the highest yet for the summer wave in terms of COVID deaths. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alright, we do have a few things to get to today in terms of news. Plus, there is a poll that I took just about an hour or two ago, and already it's gained a lot of attention. It's in relation to Novavax. Think you know, maybe knowing where I'm going with this, because there's been the emergency use authorization lately, but not much has been said since. And, well, we'll get into that in a little bit. Starting off with Slovakia. We normally would start off on Mondays with New Zealand. I haven't seen anything posted about New Zealand, so we'll start off with Slovakia. And I found this on X. Slovakia, the number of COVID cases is increasing across much of the country, and wastewater is showing an increase there in Slovakia. So, yes, it is starting to rise once again in other places now, while COVID cases in the United States are dropping. More on COVID cases in the United States in just a few moments. Maine, the great state of Maine, is now considering a public health emergency over mosquito-borne illness. This is the triple E illness, as animal cases are now starting to increase. Yes, they are finding it in more animals now. I read that it may have been even found in a horse. So this is something that is relatively concerning, and something that we need to continue to keep an eye on. The only other time they did the public health emergency recently was for COVID-19. It has never been done in Maine for a mosquito-borne illness, so this is not good. Long COVID, just a little bit of news here. It's a study. I'm not going to read the whole study here on video. Of course, I'm going to make a thread today. I didn't yesterday. Today there's enough news stories. I'm going to make a thread today with links to all the things you see here today in terms of news. And this one talks about long COVID significantly affects children for up to 36 months. Vaccines offer crucial protection. Yes, look. Vaccines do offer protection, but do they fully prevent long COVID? No. There have been people that have still gone on to get long COVID despite being vaccinated and boosted. We just hope that the vaccines, that while they can't stop transmission, can keep the severity of everything down. But yes, this is interesting to know that long COVID, again, it continues to hit our kids. This will be in today's thread, and it will be in the studies section of our site with there is a section on my site, datareport.info, for studies with COVID in kids. Alright, here we go. You've waited for this. I waited for this. I had a suspicion. I put something on Twitter on Saturday saying, man, taking a look at the different states that have come in, and it just was not looking good at all for death numbers this weekend. Well, here we are. Sure enough, they're not good. Let's read all the numbers. New cases for the United States from BNO News is 165,705 new cases. The average is 171,000. That is down by 635. In the hospital, 5,296. That's down by 61. In the ICU, 620. That's down by 7. And here it is, the new death number. 1,555 new deaths added this week. No, this is not a 2020, 2021, 2022, 2023 count. This is September of 2024. And here we are. We're back to a week with 1,555 new deaths once again. That is a horrible number. I'm hoping we're coming near the peak of the death wave for this particular wave, but I don't know. I think they're going to remain above 1,000 for several more weeks, but hopefully they don't go any higher than this, because this is getting concerning now. Average weekly deaths is now up to 1,257. That's up by 199. Then they go on to say the COVID summer wave is starting to ease, with the first drop in new cases in more than 3 months, even though deaths reached 1,500 for the first time since March. This week, cases increased in only 8 out of 28 states, with consistent but limited data. Deaths take longer to report and will likely remain elevated in the weeks ahead. Yeah, I think for the rest of September it's going to remain above 1,000, but who knows? Maybe we can be hopeful and they can drop sooner. Not looking likely, though. Out of all those deaths, this clearly signals the issue with hospitals not reporting. I mean, that's a lot of deaths with the number of hospitalizations. Let's go back for a second. In the hospital, 5,296, but 1,555 deaths. That just right there shows you there's not many hospitals reporting. And, well, here's the number. Only 32.7% of hospitals in the U.S. submitted COVID data this week, the lowest since the end of mandatory reporting on May 1st. This means actual case numbers and hospitalizations are substantially higher than reported. Yeah, I would think we're well north of 10,000 hospitalizations right now. I mean, if that's 32%, could even be higher than 15,000 hospitalizations right now. Also, it says, as reported earlier this week, federal officials confirmed that hospitals will soon be required to report all hospital admissions related to COVID-19. Those rules are due to take effect on November 1st. This is the 4th week in a row with more than 1,000 new COVID deaths in the U.S. It's also the 234th week in a row with 400 plus deaths, or 1.2 million deaths in total. So far this year, more than 5.1 million COVID cases have been reported in the U.S., causing at least, this is not a good number, 355,650 hospitalizations. Again, that's with limited data, so this number could be significantly higher. Yes, that without full data, that is higher than the flu, so don't tell me, well, it's just like the flu, symptoms sound like the flu. Yes, some of the symptoms can be the same as the flu. However, COVID can randomly cause more severe disease in not just immunocompromised people. There are people that have been perfectly healthy, and at random, they ended up with a severe case of COVID. It happens. And then it says here, 40,118 deaths this year. We'll easily pass 50,000 deaths from COVID this year. It's just going to happen. I mean, we're doing over 1,000 deaths each week. It's the 4th week in a row with that. You can find more on B&O's website. All right, I did a little poll earlier. Let's refresh this to make sure it's up to date. And yeah, okay, it is. And this has to do with Novavax. For those who want the Novavax booster shot, are you having issues finding it? And I put some comments will be used in tomorrow's update. We'll probably look at this again tomorrow to see the final results. 274 votes so far, and that's just as of, what time did we post this? 1:55 p.m. So, I mean, it's getting a good number of votes. I'll probably retweet this again tomorrow morning. And it says 94.2% said yes, 5.8% said no. Yeah, there's problems getting Novavax. The reason why I did this was because I was starting to see comments on my postings, other postings about people having issues with Novavax. I'm going to be calling the pharmacy I got my last Novavax booster at here in Southeast Pennsylvania, probably at some point this week. I'll let you know on that. I know I have some followers here in Southeast Pennsylvania. I'll let you know what they say, and I'll even tell you what the pharmacy is called after I give them a call. Let's just read a couple of these comments. Jason M. put, I'm in Canada. It seems highly unlikely I'm going to be able to get Novavax this time. Yikes, that's not good. And then Electric Warren put, early this morning, the Novavax site showed all the major farm retailers, and each was marked as not available yet. Yeah, that's not good, someone's saying. CVS this morning said they're waiting for shipment. Seems to be pretty much the theme, and I am getting comments about Canada, UK. We know it's approved in the United States. Just have to wait and see what's going to happen in the other countries. All right, let's refresh the heat-related illness map and see if we can get the new update. It should be in by now. It's 3:27 in the afternoon. Usually comes in early afternoon. We can see here Yeah, there's still, wow, look at this. Ohio, Michigan, Wisconsin, Illinois, Kentucky. Yeah, it was hot there for a little while, and you're going to be hot once again. Even portions of the southern and central plains, you're dealing with some heat-related illness calls. Long Island had a few. Don't know what that's all about because it hasn't been that bad in the Northeast, and even a couple up in Maine and upstate New York. It is going to get warmer, though, this week. It's going to go back into the 80s, so maybe you started getting accustomed to these cooler temperatures. Well, get ready. Some 80-degree weather's coming back for the Northeast. That could impact things. And take a look at Virginia and North Carolina. We can see here heat-related illnesses there, Florida, and the Southwest U.S. as well. And, of course, Oregon, we expected the rise there. You're dealing with sweltering heat, as is California. I could see California potentially go higher once again. Taking a look at the pollen map, 54% of the country is in medium to high status. Tree pollen, ragweed, grass, I guess, is an issue right now. Some of those issues I've been hearing about around here. Taking a look at air quality levels, you know what you're going to see. You're going to see the West Coast once again looking, wow, look at this. Up in Oregon and Idaho and Washington, really bad right now. And just east of Los Angeles as well. The eastern United States is not doing too bad, but we got to pay attention to this. If the jet stream should come down and push things to the east again, suddenly all that bad air quality from wildfire smoke would shift to the east. So that could be problematic down the line. Something we have to keep an eye on. Something else we have to keep an eye on. Let me refresh this real quickly. Take a look down here. Yes, there is a tropical system in the Gulf. It's expected to become a hurricane and make landfall in Louisiana. When I have time, I'm going to be doing tweets on that. I'll probably have the 5 o'clock update when that comes in. Then, well, actually, it would be 4 o'clock Central Time because the storm is in Central Time Zone, but you get the idea. The next update, I'm going to be posting that there from the CDC, and I can tell you, or CDC, the NHC. We're talking weather, not viruses at the moment. Yeah, it's likely this is going hurricane. It's already strengthening, so please prepare if you live down in Louisiana. Philadelphia yesterday. I'm happy with this. 735 EMS incidents. The peak of the heat-related illness-virus combination. It came, but we're still going to see days here and there that go above 800. With these upper 80s coming, which will impact here, Philadelphia, I suspect we may see this level go up again. Plus, parts of Philadelphia's wastewater on the most recent update was increasing once again. We'll have a look at southeast Pennsylvania tomorrow. Whoa, what is going on in Montgomery County, Pennsylvania? Pardon me for being a little excited here. Am I reading this correctly? There are currently 26 EMS incidents in Montgomery County, Pennsylvania. I'm seeing allergic reaction, subject in pain, medical alarm, respiratory emergency, fever, cardiac emergency, altered mental status showing up many times, stroke, cardiac emergency, nauseous vomiting, cardiac emergency again, head injury, vehicle accident, cardiac emergency, sickable episode. My goodness, 26 calls? That's the highest we've seen during the daytime at any point during the summer, and we do know wastewater for COVID has been going up there, but seems to be there's a lot of other stuff going on right now. Phew, that's not good. But meanwhile, Chester County, I'm going to refresh to make sure this is up there. Meanwhile, Chester County is nowhere near as busy. 26 calls in Montgomery County, 1, 2, 3, just 5 calls in Chester County. Okay, I've seen stranger things happen before. All right, we're not taking a look at Pennsylvania wastewater. That's tomorrow. The viral activity level in Canada today is coming up at moderate for COVID, moderate for influenza A, not detected for flu B, and RSV is low at this time. All right, Walgreens did do their weekly update. We're just going to do a few states, and then we'll do some more states tomorrow. Sound like a winner? Alrighty. National positivity rate, it did drop. It's at 29.9%. The prior week was at 32.9%. That's down by 3%. Total tests, 10,030. Prior week was 13,537. And let's take a look at a few states. Since we just looked at EMS calls in Pennsylvania, let's do Pennsylvania first. And, yeah, I expected this. And even though total testing's dropped, I think it's legitimate. 36.7% COVID positivity rate. The prior week was 33.1%. That's a difference of up 3.6%. Total test, 109 versus 124. I mean, testing's down, but again, I've been watching wastewater in my state rise, and while you just saw Montgomery County EMS calls, there's a heck of a lot of them right now. New Jersey positivity trend is 34.1% this week. The prior week was 31.9%, difference of up 2.2%. Testing is down slightly, but New Jersey cases, I'm hearing, have been starting to go up again. 264 total tests versus 285. And you know what? Let's look at the other red sites here in the Northeast. Whoa, this one's not good, but there's a pretty big test drop. Rhode Island, 44.8%. The prior week was 30.0%. Difference of up 14.8%. 29 total tests versus 40. That could be a combination of both, but again, that is a huge increase. Connecticut, your testing's down, so we're going to say your testing's down here. 37.5% positivity rate this week. Prior week was 33.3%. Difference of up 4.2%. Total tests 48 versus 63. And I'm seeing red in Arizona. What's going on there? Okay, your testing is significantly down here. 36.2% positivity rate versus 31.9%. That's up by 4.3%. Testing, 221 versus 313. So even with the testing drop, your positivity rate did go up again. So that's telling me, though you're dropping, you're not dropping all that fast at this time. Texas, this is a big state. And let's see what's going on here. 25.6% positivity rate, 29.5%. And here would be a faster drop. Why? Well, the positivity rate is down by 3.9%. Plus, testing is significantly down, which obviously means cases are dropping. 1,849 total tests versus 2,588. Let's do one more state, Washington. This is some good news because you had a small case rise last week. This would signal that has ceased. 38.3% positivity rate this week, 40.2% last week, down by 1.9%. Total test, 107 versus 179. That's a significant testing decrease. We'll take a look at some wastewater sites tomorrow. I do want to take a look at this real quickly. Just a reminder, if you live in Washington, D.C., flu, this is influenza now, not COVID. Influenza-like activity level is now moderate, so you may want to start considering getting that flu shot if you live in Washington, D.C., and if you live anywhere else in the country, put it on your mind that it's about time pretty soon for that annual flu shot. Taking a look now at New Jersey, not much I can say about this. Hospitalizations, hospitals reporting. Yeah, take a look here. You can see here 413 hospitalizations, but only 58 out of 70 hospitals actually reported. So we're not going to go through the rest of those numbers. New York State today, 1,410 new cases. You can see here they're gradually dropping. They had a little bit of a faster drop last week, but they are gradually dropping for cases at this time. New York State hospitalizations statewide, they dropped pretty good. We'll have to see what happens with the Tuesday dumping. Sometimes that goes up a little bit. You saw what happened last Tuesday, but throughout the week last week, they did drop. 1,051 people hospitalized. In the ICU, 120. My hope is that by the end of this week or next week, maybe they can get back below 1,000. It's all going to depend on what happens with tomorrow's report, and then after that. And while we're looking at New York State, let's quickly take a look and see what's happening in the New York City area. I'm curious to see what's happening there. And in New York City, yep, hospitalizations are dropping there as well. 338 people hospitalized and 48 people in the ICU. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. We'll have another update tomorrow. I am going to make a thread today on the news story shared, and if I have some time, maybe later on this evening, I'll be adding some of these things that I have not gotten around to adding on the site, including studies, and yep, we're going back in time a little bit more as well, and adding some past COVID cases or deaths from the early days of the pandemic. My goal, as you know, to become the biggest archive of that type of information, including COVID studies, that there is out there. Will it ever happen? I don't know. I'm at least going to give it a try. If you enjoyed this update, give it a thumbs up. Subscribe down below if you're new to the channel. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday evening. Thanks for watching.